When you look at the data in children, it's very clear that the risk of a negative outcome from an infection with COVID is much, much higher than the risk of a negative outcome from the vaccine, mostly because the risk of a negative outcome from the vaccine is extremely, extremely low. It's like 1 in a million type risk, whereas COVID, the risk is just so much higher. So it's definitely in the risk-benefit ratio, it is definitely more prudent to get the vaccine than to take that risk with your child. It is true that the vast majority of kids will do well with COVID. In fact, about 50% will be asymptomatic. They won't even have any significant symptoms that you would recognize. Then about 30 to 40% will be symptomatic, but will be mild enough that they'll be able to stay at home. Then another 10 to 20% are going to be sick enough to need to be in the hospital. So when kids get admitted to the hospital with COVID, it can be for a variety of reasons. Some maybe only need a day or two in the hospital for IV fluids, maybe a touch of oxygen. They just need that little bit of supportive care and then they do fine. Other kids need IV antibiotics. They need IV antiviral medicine like remdesivir because they're more significantly affected or they have more serious underlying medical conditions. And then you have those kids that really struggle to breathe. They get bad COVID pneumonia. They need to be in the ICU. And certainly kids have been on ventilators. And even here at Rainbow, we've had kids that have needed to go on heart and lung bypass machines because of how severe their COVID is. And everything that we're talking about doesn't even include those kids who go on to have long-haul COVID. So believe it or not, kids with even very mild symptoms can end up developing what we call COVID long-haul syndrome, which is a syndrome where they start to develop very severe and even debilitating fatigue. They can have brain fog. They can have chronic gastrointestinal problems. They can start to develop migraines. All sorts of medical problems can come out of this. And this COVID long haul can last for months, probably even years. It's too early to tell. And kids, even with very mild COVID, can have this. And it looks like it's going to be somewhere in the range of like 5 to 10% of kids with COVID go on to be long haulers. And it's very devastating. I do the COVID recovery clinic here, and watching these kids, some of them are young, and teenagers just lose their ability to function, lose their ability to go to school, interact with their friends, lose their ability to play extracurricular sports. It's heartbreaking to watch what these kids are going through. And we know that the vaccine could prevent that from happening. And to me, that's the number one reason to get vaccinated.